All right, we'll go ahead and get started here. First, could I get a motion to allow Member Blair to participate on the phone? The first by Betty and the second by Member Allison. All those in favor, please state aye. Aye. Opposed? All right, welcome, Member Blair.
Thank you.
All right, next we have the approval of September 24th minutes. Could I get a motion? Member Daly, a second. Member Hare, any additions or subtractions? All right, all those in favor, please state aye. Aye.
Aye.
Opposed? Okay. And we will jump right into the budget book, and we're going to take all four of these at once. So can I get a motion to put the budget for the Health Committee on the floor? Member Allison, and second by Member Coates. Okay.
All right. Thank you, Mr. Chairman. As we've done for each committee thus far, we've got a short slide deck, shorter than in years past, to walk through for you. So this slide is definitely getting a little redundant at this point. Probably everyone has seen it, but for anybody that might be watching the live stream that didn't watch the other committee live streams, this is our sources and uses information for the FY25 recommended budget. Top half are sources, which is where the money comes from. You can see it comes from a wide variety of sources. The dark blue or navy blue portion of the line represents all funds. The light blue represents the general fund. On the bottom half, you can see uses of funds. So that's how we spend the revenues that we generate. Again, navy blue is for all funds, and the lighter blue is for the general fund. Both the general fund and the entire recommended budget are balanced. The general fund is at $60.3 million, and all the funds are at $157.9 million. This committee has 4 budgets that it has oversight of. All of those are special revenue funds, so there are no general fund. There is the Regional Office of Education. So you have 1 general fund department and 3 special revenue funds under your purview. Across those 4 budgets, revenues are almost $10.3 million, and expenditures are just a shade under $11 million. Some historical comparisons for you for revenues and expenditures. Top half being revenues. You can see the bar chart where intergovernmental revenue has ebbed and flowed over the course of time, and say, for example, other financing sources or interest income actually has, as we've increased some of our balances, interest income has increased along with the favorable interest rates that we've seen in the work that Treasurer Bierke has done with our investments. On the expenditure side, you can see that with the exception of the capital outlay in FY23, most everything except personnel and contractual services are pretty minimal, but the majority of the expense is in either personnel or contractual expenditures. Where does this committee stack up for across the entire budget compared to the other committees? Well, this actually has it highlighted at County Health is at 7% of revenues and 7% of expenditures. In the general fund, you can see the $19,000 of revenue in the Regional Office of Education is less than 1%, and their expenditures are roughly 1% of the general fund. And that, Mr. Chairman, is the short slide deck. We're happy to answer any questions you might have.
Thank you. Are there any questions? All right. I just have one quick question for Monica. And the only reason I ask this is just because part of the reason why we approved the new health department was because there was going to be more efficient and less intake areas. And I just hope Monica can address what we're going to do with some of the employees that had intake and some of the additional training that they've had.
So More than happy to answer questions related to our operations. We did start at our last contract with our union. We negotiated for two of our positions or grades to actually merge, which would be part of our first floor centralized intake, and that would be our WIC office assistants as well as our clinic assistants. That went into effect. The actual merger of them went into effect with the union contract changes here this past July. We started actually cross-training exercises with them as early as last February. So we have brought it to a point where the staff that are now clinic assistants, because they reside or co-located partly at our California Avenue location, are able to do intake for WIC and intake for our immunizations program as well. The second part of the training will actually be doing our intake for our STI program, or sexually transmitted infections, because that primarily is housed at Human Service Center, which does not have any of our WIC services. That cross-training is going to be further developed as we actually get into the building, but the core part of it has actually been done. Overall, from an FTE count, we've actually put one FTE already on hold. We do potentially think there might be variations of the second FTE as well. The second intake area is upstairs, which is our vital records area and our environmental health. Because those are not co-located in the same facility, environmental health is out in the highway department. Vital records has been for the past 2 years at the coroner's office. We are starting, the two supervisors have actually worked and looked at where the alignments happen for both of those positions. However, we won't really start that cross-training process until we're in the building. That's largely because, similar to what we saw at California Avenue location, when staff are together, they tend to see each other's work and are able to understand the nuances and can kind of share, like, I also do that. I also understand this process. So it really becomes staff driven, which is what we want in this process. I know it'd be further down in informational, but you may have seen that the Board of Health did vote to terminate our dental program and partner with OSF St. Francis Medical Center's dental residency program to offer both adult and pediatric complete services at the new location. Because of that, we never went forward and did dental cross training. So that's why dental was never included. So they'll share a front desk area, but they were never part of the cross training because we anticipated this long-term planning. Overall, though, I will say, as it relates to the budget, there is not a drastic FTE change in our budget, and that's largely because January 1st of 2025, the state has adopted decreasing the threshold for what is considered an elevated blood lead level in children. Right now, if a child tests with an elevated blood lead level, EBLL as we term it, of 5 or greater, first with a capillary and then with a confirmed venous, then we do an environmental health assessment as well as a nursing assessment. Because the state is actually dropping it, we anticipate that based on the data that we know, and what I mean by data that we know is because it's dropping down to 3.5, we know that from the data we currently have where a child may have tested high as a capillary and then their venous came back as a 3.5, just from that, we see an increase of our cases for us to follow up by a factor of 5. What we don't know, and we expect even a greater increase, is that now that a capillary is also decreased, which that data has not really been shared with us, that can actually then trigger even more follow-up. So we expect it anywhere to be actually a 10-fold increase in the number of cases we're seeing. So from an FTE count, we adjusted our nursing side of it to reflect that change because we will have to do nursing home visits. We maintained our environmental health program, but also, again, further down in Board of Health update, we did receive our HUD grant for another 4 years at over $6 million. And so based on the state's changes as well as our new HUD grant, we also looked at our FTE model and our processes for actually doing that work and adjusted our FTE. So overall, you do not see a large decrease in our FTEs based on the cross-training alone. And that's largely because of that lead program that's coming into play here starting in January. So a very long answer, and I apologize, but more than happy to share.
No, I appreciate the answer because, like I said, it was one of the main points when we were having the discussions of the new facility. So I appreciate the understanding. Does anybody else have any questions? Thank you. All right, Member Williams.
Scott or Monica, can we talk about the Peoria County Board for the Care and Treatment of Persons with Developmental Disabilities? How do they choose those grant recipients?
They do have a grant-making process. First and foremost, an eligible agency does have to meet the requirements of what the Care and Treatment Board was established for, and so it's persons with developmental disabilities. I would say longer than I've been an employee, the Care and Treatment Board has chosen to focus on children and adolescents versus adults. So long history there, and they've got one of their board members that also sits or historically has sat on the United Way's Solution Council. So he coordinates some of that grant-making process from the board's perspective. They evaluate the requests, and then they make awards based on funds they have available and what the requests of the agencies that ask for money are.
Thank you.
I would just add they are 3-year grant periods right now. So the contract for them, once they're awarded, is for 3 years.
Thank you. Did you have something else, Member Williams, on the budget?
Yes. I'd like to make an amendment to the Solid Waste Management Fund to reduce the staffing salaries by $39,408.
That would be the position that's not filled at this time.
Correct. It's an unfilled position.
Okay. Can I have a motion? Member Williams? And Member Daley is the second. Does anybody have any other questions on this? Okay, so we're voting on the amendment. All those in favor, please state aye. You have a question?
Would you reiterate the amendment that Sharon suggested?
Sure. Right now in the sustainability office, there's 2 positions. Becca has one. The other one we kind of put on hold last year to see what was happening with the landfill. And her recommendation is to remove that position and inactivate it at this time until we start getting tipping fees again, or until the transfer station is built, and then revisit that position. So it would be removing that position from their unfunding it at this point. All right, all those in favor, please state aye. Aye.
Aye.
Opposed? Okay. Any other amendments or questions on the budget before we take the vote? Okay, so we're voting on the budget as amended. All those in favor, please state aye. Aye.
Aye.
Opposed? Okay, thank you. Next, we have our informational items, and we have the Board of Health.
Thank you. I also noticed in talking to the chair that later on in your agenda for informational is cure violence. I think we agreed that that might have been just a carryover from last month's meeting. But overall, as I mentioned, we did receive our HUD grant, which does allow us to, again, do 4 years of work related to lead within our communities of those high-risk zip codes as well. We did have our strategic planning as a Board of Health does its own strategic plan as part of an accredited health department and also being a certified local health department. So we've actually went through that process, and we'll have a final approval. And then in regards to our cure violence, just an update that we are looking at is our Board of Health did work with the county CFO on a planning phase contract with Sickage for that external audit as part of the process. And then we did release today a notice of funding for the home ownership program. So You, as a board, as well as the city council, approved 1.2 million of ARPA dollars for a public health equity fund. Last year, we provided 2 projects with that funding as a Board of Health. The first one was towards assistance for Phoenix Manor. The second one was a home rental program. And the third project was go to home ownership. So we did release the NOFA today for that. It's posted on our BidNet. There's a press release as well as some follow-up information. And this, again, aligns with the project that Dr. Leslie McKnight presented on, which was the social determinants of health, where we saw that housing specifically was called out as a major issue, one being affordability and habitability in some of our most impoverished neighborhoods. And so the project for the home ownership ties directly into that accelerator program that we had with the CDC. More than happy to answer any questions.
Thank you. Any questions? I don't know if you've driven by the health department recently, but the fence is down and you can actually get a good view of the building and the landscaping. So very excited about the progress that's being made over there.
I believe we have occupancy permitting in about 2.5 weeks, 2 weeks.
Looking for movers.
I'm going to hire my own kids if I can just get into that building as soon as possible.
All right, thank you. Next we have care and treatment, if there's anything to report.
Nothing new to report, Mr. Chairman.
All right, EMA, I don't see Jason here. His report is in the packet. ROE. Good afternoon.
Good afternoon. 2 quick things. Number one, we were just awarded a PFA expansion grant. As you know, Preschool for All, we have 4 classrooms, 2 at St. Paul Baptist Church on Knoxville, 2 in the Bartonville area, and we were just awarded 4 additional classrooms. So we are currently looking to hire teachers and assistants for all of those classrooms and looking for placements for those. We would love to keep them all together. Bright Futures was also awarded an expansion, so they are building and developing in the Dunlap region. So we are looking to go elsewhere. We've got lots of conversations going in the community, so if you have any ideas, let me know. And then secondly, as you all know, literacy is a passion of mine, especially with some of the concerns over literacy scores on the kindergarten readiness assessment. So you should all know who this lady is. I am here to help promote. If you don't know, every child under the age of 5 in Peoria County can have a book mailed to their house every month. They don't have to do anything but sign up. We must get more books. And so I have been partnering. So if you don't know how it works, the state of Illinois, through their budget, is funding half of the library. The other half is being funded by Shared Blessings here in Peoria County. Darlene Violet, if you don't know Darlene, she's a wonder. She has raised a ton of funding for this, has plenty of money. We need kids to sign up. So I'm going to have this in my office. You can use this code right here. And I'm getting a bunch more of these made. There's a tear off. You just fill out the address. It is that simple. The book comes to the house. You don't have to do anything. So please help me with that effort. There's a research study that says you can count the number of books in a child's house, and that will determine their literacy level in 3rd grade, just counting the books. So help me get that out. Every zip code in Peoria County is eligible. So with that, we have a great report on truancy.
Good afternoon. I just wanted to provide you just some numbers. We are fully up and running with all of our new people, so they've taken on all of their new schools. They did some shadowing of our more veteran truancy workers, and so now they're off and running on their own. Currently, this was from last week, we had 99 students referred, 89 active, so that just means some students may have moved out of the county or they may have been dropped for attendance. Total of 521 home visits. That was really kind of with just our 3 people, because again, it was last week and they just kind of started after District 150 came back from fall break having their own schools. But yesterday alone, they had 74 home visits between all 5 of them. We've made 229 phone calls. Of our tier 1 students, 58% of them who have been working with a student support specialist, truancy worker, for 4 more weeks have improved their attendance. Like I said, I listed active referrals by each student support specialist, but that's going to go up significantly after fall break. Like I said, yesterday alone, we got 52 new referrals. So we will really be kind of amping up here after fall break. I did a breakdown of active referrals by grade and active referrals by schools. And I think everybody has those. Okay. Also wanted to note that on October 15th, kids started to become medically exempt if they didn't have their physical. So we've been running into a lot of that. Our people are out there working with the parents. They're getting them appointments. If a student has an appointment, they can return to school if they provide the appointment card. So our people are going out, working with families, getting them appointments, and attempting to get the documentation to the schools, but there's some privacy issues there with the doctor's offices giving our people the paperwork, but we're working on it. So we are working with families and schools to get these medically exempt students back into school. We had a truancy advisory board last week. We had a family come in. They have a kindergartner. He had about 22, I think, absences since the beginning of the year. The thing I really like about Truancy Advisory Board is that it gets the parent and the school in the room together, problem solving. And so there was some miscommunication about how to call in a student absent. There was some miscommunication on if the parents could walk the student to school. It's a kindergartner. He had some reservations, it being his first year. And so we got a plan worked out where the parents can now just walk him, get him to his classroom. And then since we've had Truancy Advisory Board, he's had 1 absence. So I think, Truancy Advisory Board's a great way to get the parents, the families, and the school working together, coming up with plans to address attendance. That's all I have, unless anybody has any questions.
Thank you, and thank you for 7-page report. I mean, no, really.
I wanted to give you everything.
We asked for data, and you provided it to us, so thank you.
Yep, and I will continue to provide that each month. So.
Not only are the success stories great in knowing that we're investing in something, but also seeing the numbers. It's good, so thank you.
Thank you, guys. Have a great rest of your afternoon.
All right. Next is sustainability.
Good afternoon. I just have a few updates to what was in the packet. We did do 2 electronics collections, or I did 2 electronics collections in October, end of September, beginning of October. The one on the 25th in partnership with Kusakowski and Limestone Township yielded a little under 9,000 pounds, and the Peoria Township targeted one received a little under 2,500 pounds. So both successful events for the group that I was reaching out to. For holiday light recycling, we'll start again this year. Still looking at scale and the making sure the partners are all still on board and what can be managed there. But all of the partners are still on board just in terms of the hauling of the recyclables. For education and community, the Illinois Solid Waste Management Association conference is today and tomorrow. The IEPA just mentioned or released a lot of information about federal funding being passed down through the state. for materials management grants and solid waste and recycling infrastructure. So very exciting there. The Township Supervisors Group also did meet, and that's, I think, in there. We'll meet again on the 8th. Great partners there in terms of executing some of the collection events. The Regional Food Council, I don't know if Monica may have included this in her packet too, through the HEAL partnership, did have a Hunger Summit at the beginning of the month, the 9th and the 10th, well attended. So that was great. United Way campaign is not listed in your agenda brief, and that is underway. The auction closed Friday and raised a little over $2,100. So that is going through the end of this week. Through Green Crew, I hosted a couple things. Fix It Friday, staff to mend and patch and hem some clothes to sort of, and then provide some education on reducing fast fashion and making sure that you're taking care of your items as a sustainable approach to reducing waste in your closet. And then the utility usage is included for electric and natural gas through the third quarter of the year. And I specifically wanted to call out the small decrease in jail electric. I maybe should have included another year in there too. You know, some efficiencies have been done there. Mostly has held steady, but a small 2.2% decrease in jail electric. And then JDC electric, I wanted to specifically highlight the warm months of 2024 with that new efficiency boiler in place. You can see the reduction of electrical usage in air conditioning. And that's all I have, unless there are questions.
Thank you. Does somebody have any questions? Nope. All right, thank you. Next, we have the Center for Prevention of Abuse. Welcome back. I swore you were just here last month. Time flies.
Time certainly does fly. Thanks for
Yeah.
letting us come back to fill you in on our partnership. This last quarter was a bit of a difficult quarter for our ombudsman. We had a third of our staff that had to resign because of retirement and or health issues. So in a field such as ours, there's a huge learning curve that would apply to that. And then of my remaining staff, COVID made a ugly appearance, and we had two other staff that were out for the better part of a month. And unfortunately, COVID is with us, especially in our field. Right now, there's probably a third of the long-term care facilities within all counties of our service area that have COVID outbreaks, and some of them are very significant. And we're seeing this go around. A lot of the cases are very severe, as opposed to what we saw in the spring and the summer quarters. I did want to share a couple of things with you. We were able to see 50 cases closed during this quarter in Peoria County alone. That's a record for the Center for Prevention of Abuse in Peoria County. And we're quite proud of the work that our people have done. And I did want to share a few success stories. Numbers don't tell the whole thing. Our people go in with their help. We're able to reach residents in their homes and the skilled nursing facilities and the assisted living, supportive living. We also go to SMRFs, Specialized Mental Health Unit, and we go to developmentally disabled homes. Every licensed and registered home within the county receives one regular visit, and many of those homes in Peoria County get multiple extra visits. We had an ombudsman that met with a resident in the dining room that was very unsettled, and this resident told our ombudsman that He wants to go home, but the doctor said to go home he has to gain weight. He had been in the hospital for surgery. The doctor had ordered larger meal portions for this resident, but the facility refused to allow him to have extra portions of protein in particular. Our resident gave our ombudsman permission to advocate, and he had been fighting for the better part of 2 months. It just took one well-timed visit by a very good employee of mine that was able to get this fellow the extra meal portions, and she visited with him about a month later, and he was proud to show her that his pants were getting kind of tight, and they had a discharge date set up for him. So that is a huge success. We had another resident that had broken her ankle and had had surgery. She needed extensive therapy to regain her mobility. After moving back to the nursing home, of course, sometimes issues with Medicare can be a problem if that resident doesn't progress as rapidly. And then when you coordinate that care with Medicaid, it can become difficult. The resident was kicked out of therapy, and our ombudsman was able to speak to the staff, and we advocated for the therapy to be continued. And after speaking to the staff, the facility had granted charity therapy treatments for 6 more weeks, 2 times a week. And because of the extra treatments, that resident gained her mobility, and she's no longer in a wheelchair. She's able to walk, and that is a huge thing. We had an ombudsman that helped a resident that needed a wheelchair repaired. His wheelchair was broken, needed 2 new wheels on it. The wheel bearings had totally worn out, and the chair was the wrong size for this resident. And not only was the resident, he would have been happy to get a repair, but we were able to get him a brand new chair as a result. Oftentimes, I think these facilities want to help, but they just need a little bit of encouragement. And that's what our job is to encourage them to do the right thing. And we're seeing a number of residents within Peoria County especially that are not a typical candidate for a nursing home due to swimming accidents, due to automobile accidents, due to drug misuse. We're seeing a number of residents in their late teens and early 20s that are entering long-term care. And we had a young fellow that was a quadriplegic that needed some changes to his care plan. He wanted to request specific people to help him to take care of his personal needs. He, because of his injuries, he was in a swimming accident, needed some help with his spasticity and pain issues, and facility was not overly excited about helping. But in case any of you have a loved one that's in long-term care, every resident has the right to a care plan meeting every 90 days. We have some facilities that are still saying they can't safely give a care plan meeting, and they've used that excuse since the beginning of COVID. And we're very happy to go in and to remind them of their legal obligation. And this young gentleman received a care plan meeting, and he started receiving physical therapy, and he's now able to get around more comfortably in his wheelchair. Some of these things may not seem like a huge thing, but I tell you, folks, if you're in a wheelchair, it means all the world to be able to get around and to move. So that's just some of our success stories over the last quarter I wanted to share with you. I don't know if any of you have any questions.
Thank you. Does anybody have any questions? No? Thanks again for the update. Appreciate it.
Yes, sir.
All right. Next, we have the quarterly strategic plan update.
Thanks, Mr. Chairman. So you'll find that in your packets. Happy to answer any questions you might have.
Any questions on that? Okay. And finally, we have one resolution, and that is the amendments to the Chapter 10 Food Safety of Peoria County Code of Ordinances. Could I get a motion to put that on the floor, please? Member Hare, and second by Member Duncan. Hello.
Hello. My name is Carrie Panare. I am the current Director of Environmental Health for the Peoria City County Health Department. And I've been the director for 6 years of my a little over 23 years in public health. So today we bring forward revisions to our Chapter 10 Food Safety Ordinance. And it is on. Okay, thank you, Scott. All right, so the next slide, please. So this slide just goes, gives you an overview. Just want to make it a clarification that we adopt the state code by reference. The county ordinance is allowed to be more restricted than the state code, but never less. One of the reasons we're opening up our ordinance is to align with the Illinois Department of Public Health's adoption of the most current 2022 FDA Model Food Code, as well as a few Illinois-specific items, and then finally some county-specific revisions. Next slide, please. Just a brief overview of some of the acronyms that we use in our in the food code world, if you will. I know sometimes it can be confusing, so I'll not go line by line for that one. Next slide, please. So currently in Illinois, we are on they've adopted most parts of the 2017 FDA Food Code, and now in 2024 for implementation in 2025, they've adopted the 2022 FDA Model Food Code. The FDA Model Food Code has revisions and updates. It's on a 4-year cycle, and so we'll probably be back in a couple years when Illinois hopefully adopts the next version to align. We tried to do some wording so we wouldn't have to every time they did that, but I have a feeling we'll be back even still. So, next slide, please. In addition to the adoption of the 2022 FDA Model Food Code, Illinois did some specific things. For example, they added some clarification or changed some of the definitions for risk categories. Risk categories are what define food establishments. There's category 1, 2, and 3, and that's their level of risk is based on their food handling practices and operations. So, for example, a bar that serves drinks would be a lower category. A hospital or long-term care facility or a 24/7 food establishment would likely be a category 1, either because of the population they serve or the types of food handling practices. The 3 different acts and or notices that Illinois, so the latex glove ban, allergen notice, and children's meals default beverage, those have actually been in law for a few years, but Illinois, with this code revision, added those, so now they will be on our inspection report. We've been doing education on those for the last several years, and we don't anticipate that changing much. Slide. Now this slide covers some of the county-specific changes that we are adding. So because the state didn't adopt some of the FDA food code annexes and public health reasons and documents that help us do our job better, we decided to incorporate those into our ordinance. We added a definition of change of license holder. We had a policy and procedure for years on change of license holder, but we thought to solidify that and make it more clear and less confusing to our staff as well as clients, to just go ahead and add that definition into our ordinance. Commissary has been in an ordinance, but we decided to add shared kitchen to that. Shared kitchens are becoming more and more popular. It's kind of interchangeable with commissary, but we wanted to help facilitate the use of and or expansion of people's ability to have commissaries or shared kitchens. And adding shared kitchen to that definition, we did also add some definitions around shared kitchens and commissaries to help facilitate when we have shared kitchen users in our county and they want to go operate in other counties, so that they will have less challenges, if you will, when working in other counties. We also decided to add farmers market to include as an event for our temporary food events. We have recognized them as events for temporary food, but not all counties do, and we just wanted that to be more inclusive. And then under food establishment, we added employees as chef for hire to not be, basically that's a private operation, and so that was spelled out to not be considered a food establishment, which would be under law to meet our requirements of our code. We just, for some grammatical stuff or some things based on state's attorney recommendations, we capitalized all of license holder to be consistent. To simplify our remodel and remodel plan review, we decided to eliminate major or minor and just have one definition for remodel. This will help with efficiency and clarification for both staff and clients. And then we added a clarification for the frequency of inspections because there were two different interpretations in our office, and so to make it clear, we worked with the state's attorney's office. Our inspection frequency that's spelled out in our ordinance is more is more frequent and at a higher expectation than what's spelled out in our local health protection grant rules. And we wanted to make sure that if for some reason, whether it be another pandemic or staff turnover or some other challenging situation, that we would have the ability to work with our Board of Health to meet the expectations that are outlined in the local health protection grant rules. And I didn't want it to just be because I said so type of thing. So I wanted that level, that checks and balance in there, which was in there, but again, we wanted to tweak that language to make it explicitly clear. And then by changing our definitions of, or eliminating major and minor remodel, and just having one remodel, we basically eliminated the two separate fees and just have one fee now for a remodel. Does anyone have any questions?
Thank you. Are there any questions? Member Elsasser, can you use your microphone, please? So everyone can hear.
Maybe I missed it, but was there anything in there about the church ladies bringing their pies in for fundraisers? That's the biggest question I get over the years.
Nothing specifically, and nothing has changed over the years with regards to that.
You still don't want them to do that, or?
It depends on the situation
Okay.
and what types of pies.
Okay. And also, have you presented this to any of the food vendors or users of this, in our local area?
For this go-around, we did not use our food safety work group. The majority of the things we were doing initially were to align with the state changes. And we know from just conversations, unofficial, not with our food safety work group, but they would be on board with us clarifying some of those other definitions to facilitate their operations. Specifically with shared kitchens, that is a huge topic lately. Distillery Labs and some other local groups are working on creating a shared food network that we've been involved with. So there's there's a lot of support around shared kitchens and making it easier for people to work in those instead of having their own full operations to cover the cost themselves. So it's like a shared ability to share, but still be food entrepreneurs.
Okay, thank you.
Any other questions? Member Blair, do you got any questions? Oh, we lost her. Okay. Hope she's okay. All right. Oh. Do you have any questions? Okay. All those in favor, please state aye. Aye. Opposed? Okay, thank you.
Thank you.
Next we have public comment. Miscellaneous. Anybody have anything for miscellaneous? Okay, we're adjourned. Thank you.